Well, greetings everyone. My name's Will Wakeling. I'm the Dean of Libraries here at Northeastern. And of course I want to welcome you all here today, particularly our distinguished author who I'll be introducing in a minute. But before then, I want to do some thanks. I want to thank the members of the library's Programming and Communications Committee. They're the people who put together this really quite elaborate and intense series of Meet the Author programs that the library puts on every semester. I'd also want to thank very much Northeastern's Women's, Gender and Sexuality Studies program, who are one of our sponsors, and the Northeastern Bookstore, who once again are co-sponsoring this event. I know Professor Deborah Kaufman, who leads the Women's Studies program, is very sorry that she can't be here herself to welcome our speaker. If you don't know about it already, the library's Meet the Author series encourages dialogue in significant contemporary questions and brings together faculty, students and staff to debate and discuss these issues. So it's really exciting. Today we've got what you might call a classic example of a Meet the Author tradition. And here's a small reminder. You can help to support Meet the Author and the series by becoming a formal library supporter. Today you just have to talk to one of the library volunteers here. We're also filming today's event. It's going to be broadcast on Northeastern's YouTube and iTunes University channels. And we'd also appreciate your feedback. So there are some forms around. If you can fill those in and hand them in to a volunteer, that would be very helpful for our developing of the Meet the Author series. Now, I find myself in a very interesting and privileged position today, welcoming today's distinguished author, Dr. Lissa Rankin. Dr. Rankin is a doctor, a mentor, and an author, and she's founder of the Owning Pink Center in Mill Valley, California, which is dedicated to redefining what it means to be a healthy, vibrant, and alive woman in the 21st century. Her welcoming and opening approach to women's sexual health and happiness issues has made the center and its website, which you should visit, and Dr. Rankin herself, a great success. And here's the special privilege that some of us here today will, I'm sure, be appreciating. This is someone who can provide answers to the kinds of questions pretty much every man I know has wondered about but wouldn't dare ask any of the women in our lives. So, however joyful and humorous the telling, that makes a book like this an even more valuable and serious window onto some of the most important issues in relationships between the sexes. If you've read any of the reviews, you'll know that What's Up Down There asks and answers in a very distinctive way all of those questions that are normally pushed under the rug. So it's an extreme pleasure to be able to welcome our author today, Dr. Lissa Rankin.
Thank Dean Wakeling just for wearing pink on my behalf, because my website is owningpink.com. So the minute I saw that, I knew I was at home. Thank you all for having me here today. It's so nice to see so many faces in the crowd. And some of you may be wondering exactly what you're doing here right about now. About to ask questions about what's up down there. And I just want to, first off, applaud you for having the courage to be here in this room, because this is not something that we talk a whole lot about, It is a subject that we tend to sweep under the rug and not something that we tend to bring out of the closet and put in the limelight. So I find myself in a very interesting position these days, being up in front of groups of people like you, talking about these sorts of issues, because 5 years ago, I had been practicing OBGYN full-time, seeing 40 patients a day in a busy managed care practice, and I had had it with vaginas. I was all done with vaginas. So this, had you told me 5 years ago that I'd be up here doing this, I'd have, turned beet red and gone crawling, looking for a hole in the corner to hide in. And yet here I am, and here we all are together. So what changed between then and now? Well, I ended up leaving my practice because I was so frustrated with the way healthcare was turning, and I really wasn't satisfied with the way in which I was engaging with women in 7.5 minutes in a busy office practice. And so I ended up exploring, what the rest of my life might look like. And I quit practicing medicine. I figured I would be a full-time artist and writer, and I would, move to the country with my family. And I did that, and I discovered that you can quit your job, but you don't quit your calling. And that I needed to be engaging with women, being in service to women, and I wasn't quite sure how. But I realized ultimately that it had something to do with this, and that I was meant to be out here talking about vaginas and getting it out of the closet. And I came from a very personal experience when it comes to that, because when I was the age of most of you here, when I was back in college, I had come to believe that the vagina was something meant to be kept in the closet. And probably like many of you, I was raised in sort of a puritanical household. My dad was a doctor, so we certainly knew the clinical terms. And I remember being 5 years old and telling people, I need to find a restroom so that I can go urinate from my urethra and have a bowel movement from my anus. And then you have your period, and it's all, vaginas and vulvas and labia and that sort of thing. But I definitely got the message that your girl parts were not something that you were supposed to talk about outside of the restroom, that vaginas were meant to be not seen and not heard. And certainly all of the evidence that I had gotten so far in my personal life had proven that that was probably a pretty good idea. My first period, I don't know if you guys aren't nearly as far from your first period as I am now. But mine was horrible. Nobody really prepared me. I wasn't expecting what was coming. And of course, I was caught in a white skirt without any feminine protection. And that wasn't such a great experience. And then nobody really quite led me to expect what to expect when I lost my virginity either. And that was a horribly painful and traumatic experience for me. Lots of blood, lots of pain, and certainly not what you see in the movies, which is all fireworks and people hanging from the chandeliers. So I got to a point where I started realizing that maybe my parents were right. Maybe this is something that we just shouldn't think about and shouldn't talk about. And then I was married, and it turned out that I had a condition that wasn't diagnosed until much later called vulvar vestibulitis, which is a condition where the vestibule, the glands around the opening of the vagina, get inflamed. And sex feels like you're getting stabbed with a knife. It hurts so badly that it was one of the causes of ruining my marriage. And I ended up getting divorced a few years later. By that point, I was definitely certain that I would never talk about my vagina again. This was something to put in the closet for sure. And I discovered that you can actually take birth control pills every day. I found this out in medical school. You can take birth control pills every day and skip the placebo week, the sugar pills, and you can never have a period again. I thought this was brilliant. Great. Like, the only thing that was still reminding me that I had a vagina was once a month, Aunt Flo came. So I did that. I took birth control pills for 9 years, and I pretty much didn't think about or engage with or interact in any way with my vagina. It was perfectly fine with me. But this is not a good thing. This is not a good thing. This is not something we should be doing. I found in the process of going through that journey that my vagina had things to say, and that if I ignored her, she started talking louder. And I started having conversations. Let's see, I'll find yoni, which is what I call my vagina. Yoni is from the Sanskrit word that represents the female genitalia, which I love because it also represents the divine feminine. So it's a very sacred word. But this is yoni. Uh-oh. So after I had put Yoni in the closet for 9 years, Yoni started yelling from the closet, Lissa, Lissa, we need to talk. And I'd say, Yoni, I'm busy. I'm in medical school. I have a 72-hour call shift. And she'd say, yeah, but there's important stuff that I need to tell you. And I ignored her for a long time. And then she's telling me one day, well, remember that guy that you married where sex hurt so much? I said, yeah. She said, don't you think maybe I was trying to tell you something? I said, what do you mean? She said, well, what do you think I mean? What might I have been trying to tell you? oh, you mean like maybe he was the wrong guy? She's like, you betcha, sister. And I thought about it, and I thought, oh, that's so interesting, because when I divorced my husband and I had a lover again a couple years later, it didn't hurt at all. And it really hasn't hurt since. So she's like, see, maybe we have something to talk about here, and maybe I can help you out a little bit. So Yoni and I started talking. And she ended up telling me, I was pushing 35 by this point. She started telling me, I think I want to have a baby. And I wasn't so sure about that either. But we talked about that for a while, and I had been dating my boyfriend at the time for about a year. And so I started talking to him about this. This is not an easy thing to bring up, So I've been talking to my Yoni. But that's pretty much what I told him. And he and my daughter are in the back right now. And that little girl who's trying to take a nap on the orange chair is Sienna. And so Yoni was right. And we decided to have a baby. And Sienna was born a few months, a year after that. So what I realized when I was pregnant is that it's very hard to ignore your body when you're pregnant. It's easy when you're not to kind of live outside of your body. And I think people sort of expect that of doctors too, that we'll just be this kind of disembodied brain, floating around. We don't have body parts. It's sort of like pastors and your parents. You know that they have vaginas and penises, but you really don't want to think about the details. So I think people think about doctors the same way, that they put us up on pedestals and they just don't like to think about that sort of thing. But that's not the kind of doctor that I am. I am a doctor, but I am also a woman, and I have been in the stirrups. I have had a baby. I have caught a sexually transmitted disease. I've had a urinary tract infection. I've gotten pap smears. I've been through all the things that all of you here have been through. And there's nothing that makes me different than that, other than I went to school for 12 years. So sure, that gives me a little credibility to be up here talking about this stuff. But in truth, I'm not so different from all of you. And that's why I wrote What's Up Down There, questions you'd only ask your gynecologist if she was your best friend. Because I wanted to write it as somebody who would sit down with you over a cup of coffee and just, sure, we can talk about this stuff. There's nothing to be ashamed of. There's nothing to be scared of. There's no reason for us to be embarrassed about these things. And I don't see any reason why we shouldn't be talking about these things. I mean, it's just a body part. We all have them, just like we have, hair and toenails and elbows. We don't have any shame or embarrassment talking about those sorts of things. And I think we should be talking about vaginas even more so, because this is where life is created. Every single one of us came out of one of these things. This is the portal of pleasure. There are 8,000 nerve endings in the clitoris, designated for a woman's pleasure. How cool is that? But beyond that, I think this is particularly important because when we don't talk about this area, we wind up with trouble. This is an area where a lot of women have experienced trauma. Many of us have been molested or raped. We've experienced abortions. We've had babies and had maybe some childbirth trauma. We've had bad experiences at the gynecologist's office, or bad sexual experiences, or pain. There's lots of reasons that we carry these traumas, and I believe that if we don't talk about them, that these things fester. And that if we do talk about them, it's part of our healing. It sort of releases this part of our body so that we can become whole human beings. We can be vital women and men, full of mojo. We can be all that we can possibly be. And that's really my goal in writing this book, is to help people overcome that kind of last bastion that many of us have not been able to overcome. And so I'm really excited to be here today, so that I hope some of you have found the table back there where you can ask the questions you'd only ask your gynecologist if she was your best friend. And I'm going to answer them just like I would in the book. Do we have some of those questions? I'm going to go ahead and bring a few up here.
So these are from the back table, but they're going to probably inspire other questions, so there are more, so please.
Awesome. Yeah, and nothing is off limits here, just so you guys know, and this is your chance. All right. Do women lose tightness as they get older, even if they haven't had kids? That's a great question. You know, the tissue of the vagina changes throughout a woman's life. So, you know, young girls before puberty, the vagina is very thin, very fragile. It really hurts if you try to put anything inside of there. And then when you go through puberty, you start getting the development of estrogen from the ovaries. And it thickens the vagina and it makes the vagina kind of a little looser so that you can actually get a tampon in when you're 12 years old and you have your first period. But these things do change over the course of your lifetime. So for example, if you look at the vagina of a 13-year-old, it's much tighter than somebody who is 30, who is regularly having intercourse. Because the act of intercourse does kind of stretch the vagina out a little bit. It's a very elastic organ. So you know, when you think about it, I think a lot of people think that the vagina is a hole that's always a hole, and that's really not the case. The vagina, just kind of like this yoni puppet, is a potential space. So when a woman's just walking around with her vagina, there's really no air in there, there's no space in there. It's two walls that are collapsed upon each other. But just like this, if you put something inside, then it becomes a space. So these walls are very elastic. And of course, as you know, when you have a baby, you've got this thing trying to come through the vagina. And, you know, that little girl back there actually, you know, somebody like that can come through a vagina. So it's very elastic. But that elasticity changes as the body gets older as well. So in the beginning, when you first have sex, some people have a lot of pain because the vagina hasn't really stretched out yet. And then after you've had 3 kids, it may be so much larger that as a gynecologist, I have to use, you know, instead of a speculum that is, you know, about this big, I end up using a speculum this big. And that's, you know, we have about 10 different sizes of speculums specifically for that reason. However, it's not just having kids. Certainly having kids stretches out the vagina some. Kegel exercises, which are kind of the pelvic muscles. Have any of you guys heard of Kegel exercises? These are exercises meant to kind of tighten the pelvic floor. So if you're urinating, for example, you're in the middle of peeing, if you try to stop the stream of urine when you're peeing, that's a Kegel exercise. That, you know, contracting that specific muscle. Those who do Kegel exercises are going to have tighter vaginas than those that haven't. So for example, somebody who's had 3 kids, it's a really good idea for them to do that. Somebody who, you know, is 15 probably doesn't really need to be worrying about that quite yet. But the question, can the vagina get looser even if you haven't had children? Absolutely. And the reason for that is twofold. First, as you get older, the collagen tissue in the vaginal area just kind of gets weakened. And some of that's just genetic. So they've actually looked at studies of women who have had babies and women who haven't had babies and who's at higher risk of having things droop out. Did you guys know that the vagina can get droopy? Some people are surprised by this. It's one of the questions in my book is, can old ladies have saggy vaginas? And the truth is, old ladies can have saggy vaginas, and the uterus, the vagina, these things can actually fall out so that it's hanging between your legs. I had this one patient, she came to me literally walking like this. I have flesh between my vagina, or between my legs. And sure enough, I looked at her and she had flesh between her legs. This is not a common thing, so don't get freaked out. It's very rare, but it is possible. And it is age-related. So after menopause, which in this country is around age 52, that's when the ovaries stop making estrogen, the vagina is much more susceptible to that sort of droopiness or kind of getting looser in its tissue. On the flip side, because the estrogen is now gone in many ways, the tissue starts to go back to being more like it is before puberty. So it's complicated. If you look at the vagina through the course of a life, it changes. It's very different through the whole course of things. But there's no reason to believe that you can't have a perfectly healthy vagina from the day you're born till the day you die if you take good care of it. So I hope I answered that question. It's a good one. All right. How many partners do women in college years usually have? You know, that varies a lot. I think a lot of us, when we're in college, think that everybody is out there having sex all the time, and that by the time we graduate from college at 22, most people have had 53 sexual partners. And the truth of the matter, I didn't get statistics from Northeastern, but the last school that I was at, the statistics actually showed that 50% of women, when they graduated that college, had never had sex. And I think sometimes we think that everybody's out there getting it on all the time, and that's not true. So it varies by region, it varies by demographic. You know, on the flip side, I have had some 22-year-old college patients that, you know, they've had 20 sexual partners already. And as a gynecologist, that, you know, it's time for me to have a talk with that person. Not to judge, but to help people understand that there are implications when you choose to have 20 sexual partners in that period of time, because it does put women at greater risk of sexually transmitted diseases. It also makes me question sort of the relationship that they have with their vagina, because, you know, I talked about putting yoni in the closet, which I was in college when I lost my virginity. I thought I was the last remaining non-ugly virgin ever out there in the world, and it was definitely something I felt, you know, uncomfortable about. But it was my personal choice. I had had lots of boyfriends, and I had done some of the everything but I didn't, you know, I didn't feel like I was ready to do that personally. And so when I was in that situation, I just kind of consciously made that choice. I think many people are unlike me, where I had sort of put yoni in the closet. There are some that are kind of brandishing their vagina out there for the world, waving it like a flag. Hello, come and love me. And I think, you know, if you feel like you can't love your own vagina, then it's tempting to go looking for approval elsewhere and to go outside of yourself. And ultimately, the only person that can give you that kind of approval is you. And nobody else can ever really validate you. It has to come from within. So I don't know the answer to that question. I don't know that there's ever been a study. There probably has been. But, you know, ask your friends. Talk about these things. I think so often we feel like we're so alone. We're doing this all by ourselves. And you're not. So if you're curious, ask your girlfriends. How many sexual partners have they had? How many women on average come in with an STD? You know, again, that depends on demographics. When I was doing my residency and I was in a public health clinic where women didn't have as much access to education and didn't know as much about the use of condoms and that sort of thing, I saw a lot of STDs. I mean, I was diagnosing STDs in probably 50% of the people that were coming in. When I moved to Mill Valley, California, where it's a very educated community and, you know, people are pretty knowledgeable about using condoms and pretty conscientious about getting tested and things like that, I hardly ever see it. The one that I see the most commonly is HPV. Do you guys know what HPV is? No. It's human papillomavirus. And it's the virus that causes cervical cancer, abnormal pap smears, and genital warts. And up to 80% of women will contract HPV at some point in their life. It's the one that I got. I did have an abnormal pap smear, and I ended up having to have a procedure called a LEAP procedure, where the abnormal part of the cervix is removed with a little electrical loop to try to prevent you from getting cervical cancer. So that one I do see frequently. I'm giving somebody a phone call several times a day to tell them that they had HPV that came back on their pap smear. Things like chlamydia, especially in college-age women, is very common. So it's not uncommon that I see that in a college-age population. Like I said, it really depends on the demographic. So knowing where you are and what you're at highest risk for based on the population that you're dealing with is important to know. Yeah. How should I treat a yeast infection? How come it doesn't go away when I use itch cream? Well, have any of you guys had yeast infections? Yeah, most women at some point in their life will have a yeast infection. Does anybody not know what a yeast infection is? There's some guys here that may be like, yeast infection, so I'll tell you just in case. You know, the vagina normally has healthy bacteria called lactobacillus that help to keep the flora of the vagina, you know, working, functioning the way it's supposed to function. And normally there are a few yeast in the vagina. So normally if you just take a swab of the vagina and you look under the microscope like we do in my office, you may see a yeast here or there. It's not a big deal. And usually those healthy bacteria keep that under control. But sometimes women, for example, are given an antibiotic for a urinary tract infection or for acne. And those antibiotics can actually kill the good bacteria. And all of a sudden the yeast starts overgrowing. And when you get the yeast overgrowing, then it can lead to kind of a thick, cottage cheesy white discharge and lots of itching and burning and things like that. And so there, it used to be that if you had a yeast infection, you had to go to the doctor and you had to, get diagnosed and get a prescription medication. Now there's a lot of products available over the counter. And so it can be really confusing. You see stuff on the media or, commercials about yeast treatments, and it can be very confusing. But there are over-the-counter products that work really well, and there are some that don't work really well. I personally use Monistat, and that, I think, is a great first-round treatment if you are going to the drugstore and you're trying to get something to treat your infection. The good thing about something like Monistat, which is an antifungal, it actually kills the yeast, and that's the only way you're going to cure a yeast infection. What can be confusing is that there's lots of products out there like Vagisil, which are anti-itch creams that'll make you feel better, but it doesn't actually cure the yeast. So you put the medicine on, your itching gets better for a few hours, you take a shower, you wipe off you clean off the medication, and the itch is back because the yeast is still there. And then, 2 days later, you're clawing like crazy because you haven't been treating the underlying problem. And so it's just multiplying. The yeast are multiplying. So, the good thing about something like Monistat is that it both cures and treats the infection. And, if you're not better in 72 hours, then you really need to go to the gynecologist. It can be easy to misdiagnose yourself. So, if you're not sure whether or not you have a yeast infection, go see a doctor, because there are other types of vaginal infections like bacterial vaginosis, which is more, it can sometimes be hard to tell the difference, but bacterial vaginosis more commonly presents with a discharge, maybe some irritation, and the most common symptom with that is a really fishy smelling odor. So, normally we have a little bit of an odor, and that's normal, nothing to be ashamed about. But if it really smells like mackerel down there, then something's off. So if you're not sure, go to the gynecologist and, make sure that you're treating the right thing. Is it normal for a woman in her 20s to never have an orgasm? Yes, absolutely. It is absolutely normal for a woman in her 20s to have never had an orgasm. There are women in their 80s who have never had orgasms, and this is heartbreaking to me because there's ways to get around this. And this is, again, one of the reasons that we should be out here talking about these things, because nobody should have to, should have to go a whole life without experiencing the pleasure of an orgasm. I mean, we were made, it still kind of blows my mind when you think about it, because reproductively speaking, most animals are created such that the clitoris is right inside the vagina. We were not. I don't know why. This was a bizarre evolutionary thing, that women have to sort of go out of their way to have their clitoris stimulated sexually. Because most women, first off, most women do not have orgasms from sexual intercourse alone. I'm going to say that again. Most women do not have orgasms from sexual intercourse alone. And those that do so because they've figured out, or their partner has figured out, how to directly stimulate the clitoris during the intercourse act. But we somehow have this notion, certainly from watching the movies, that every woman, every time she has intercourse, is, Meg Ryan at the in When Harry Met Sally. Ooh, ooh, ooh. And so, certainly me, the first time I had sex, it's like, wait a minute, that was it? It can be really disappointing when you think that it's going to be this pleasurable thing, and really, for me, it just hurt. It didn't feel good at all. And, I think we grow up thinking that that's what we should expect, that that's what it's going to be like. It's going to be fireworks and people hanging from the chandeliers. And for most women, it's really not, without a little bit of effort. And so the first thing I would ask whoever asked this question, is it normal for a woman in her 20s to never have had an orgasm? This, to me, is 3 different questions. Is it normal never to have had an orgasm with masturbation? Is it normal never to have had an orgasm during sexual intercourse? Or is it normal never to have had an orgasm at all, under any circumstance? And those are three different questions, because if a woman comes to me as a patient and says, I've never had an orgasm, those are the things I ask. And if she has tried masturbation and has not been able to orgasm, that's a different story than if she's just not able to orgasm during intercourse, which is different than if she's never been able to really experience any sort of orgasm. So the first question I get to when people say that is, have you tried self-pleasuring? Have you tried touching yourself and finding what your body likes and what feels good to you? Most of the people that come to me that say that they can't have orgasms can have orgasms alone. So that's, I think, an important distinction. Most people can have orgasms alone. And so the first thing I would say is, go get a vibrator. Experiment with things that feel good to you. And that'll tell you whether or not your body is physiologically functioning normally. So if a woman can have an orgasm with masturbation, but she can't have an orgasm with her partner, for example, in any way. Let's say she can't have it with intercourse, she can't have it with oral sex, she can't have it from manual stimulation, then usually it's psychological. So if she's able to have an orgasm by herself but not with somebody else, then usually it's ideas in her head that she's not supposed to be sexual, that all of the things that society has put out there that have told her that she's a bad girl or she's a slut or whatever if she is expressing herself sexually. Those things get caught in our brain. And if we come to believe that those things are true, then we suddenly find ourselves, here we're in a relationship, in a stable, happy, healthy relationship, or we're maybe even, married, trying to have a baby, and you still can't have an orgasm in the presence of somebody else. And for those people, what I tell them, first off, a great sex therapist is always a good idea, and they can work wonders. But if a woman can discover how to pleasure herself, and then gently try to transition that into a partnered relationship. So for example, if you can't have orgasms with another person, but you can have them by yourself, asking your boyfriend or partner or whoever to work with you on this, to say, look, I'm having trouble and I really want this to be part of our relationship, but it's been a challenge for me, and is it okay if we do this together? Most guys, first off, I'm assuming this is a woman who asked this, most guys find it a complete turn-on if a girl is touching herself. I don't know if any of the guys are brave enough to raise their hands, but any guys find it a turn. Oh, I saw a hand. Most guys find this to be a real turn-on, and women are embarrassed to do this. But if you can actually self-pleasure in the company of your partner, then that often teaches the brain, like, oh yeah, this is safe, I'm in a safe place, I'm with somebody that I care about, and they care about me experiencing pleasure. And from there, you can start to experiment with other ways to be together, to have orgasms together. Because a woman has every bit as much of a right to enjoy sex as a man does. So either through oral sex or through manual stimulation or through sex toys, and there are ways to begin to kind of teach the body how to have orgasms during intercourse, although, like I said, it's a small percentage of women that can do that. So I could go on about this forever, but I'm gonna move on.
A follow-up?
Yes.
So good. It's in your book. Of what is the definition of an orgasm?
Oh.
The actual definition, but then you talk about what it feels like.
Right.
Yeah.
Okay, perfect. What is the definition of an orgasm? Well, an orgasm is basically a physiological, neurological event where the nerve endings of the clitoris are stimulated, and it brings about a physiological change that's been well described by Masters and Johnson, who back in the 50s were sort of famous for studying sex. There's a great book out there by Mary Roach, if you guys have never read it. She actually wrote one of the endorsement quotes for my book. And she wrote a book called Bonk, The Curious Coupling of Science and Sex. And it's fantastic if you haven't read it. It actually tells the stories of how did they study orgasm. And they literally did things like, putting couples in CT scanners and, taking slices of photographs and things like this. It's a very funny book about what it means to research sex. But it is a physiologic cascade, and they describe it in great detail in their book, in the Masters and Johnson books. And it is a It was funny when I was growing up, when I asked my mother that question. She said, well, honey, an orgasm is like a sneeze. And I thought, wait, that's what all the fuss is about? But one of the questions that somebody asked in my book is, what does an orgasm feel like? And my answer was, I'm not sure how to articulate in words something so visceral, but I'll try. It's like a momentary suspension in time, which begins as a slow buildup of tingly, pleasurable feelings that increase your sensitivity and culminate in a sort of sneeze. Thanks, Mom. Which begins in the clitoris and spreads throughout the body, resulting in rhythmic, pulsing contractions in the vagina that leave you with a general sense of contentment and well-being. It's a giddy, exhilarating feeling like champagne bubbles fizzing up and popping within you. But none of those words quite do it justice. And I went on and then asked my friends. But I think that one specific thing, the rhythmic pulsing contractions, is a good explanation for those who just aren't sure whether they've had an orgasm. They're like, well, I've touched myself, or I've had somebody else touching me, and it felt good, but did I have an orgasm? I don't know. There is, for most people who have an orgasm, it's a rhythmic thing. It's just like a guy has an orgasm, and when a guy has an orgasm, you can tell. It's easier for a guy to tell because they ejaculate, and semen comes out, and it comes out in little spurts. A little bit here, a little bit here, and you can sort of tell when it's done because they quit spurting. So women don't do that. So it's harder. Well, I shouldn't say women don't do that. Some women do ejaculate, and there's a whole section in the book about that. But most women don't, and so it's much harder sometimes for women to know, have I had an orgasm or not? So if you're not sure, look for that rhythmic pulsing contraction feeling of the vagina kind of contracting down and pleasurable feelings that are rhythmic in the clitoris. But I didn't want to answer this question by myself because, of course, I can only speak to my own orgasm, and there are millions of women in the world who have had a different experience than me. So I have about 50,000 Twitter followers. If any of you are on Twitter, I'm at Lissa Rankin, LISSARANKIN. And I have a bunch of Facebook followers, and I have a website, owningpink.com, and there's a whole community of women there. So I put it out there to the universe and said, can you help us understand what an orgasm feels like? So here's one of the descriptions. Like a roller coaster ride, it takes a while going up, and it's a fun ride down. Like an internal explosion, sort of like a volcano erupting. You become warm and fuzzy all over, and then for a brief moment, you become one with the universe. A good orgasm feels like an out-of-body experience, like a little death, but in a good way. The ultimate tension release. Warm, glow, adrenaline rush, calm and bliss all at once. You are transported into a secret world of wonder, ecstasy, and fantasy. At that moment, the mind stops, there are no questions, and there are no answers. You feel the ultimate availability of unharnessed life force energy exploding through your body in wild abandon. Your whole body floods with heat, all from one starting point. Your entire being relaxes into receiving and feeling every moment of pleasure and love for yourself. You plug in. And this one's my favorite. Animal longing transforms into pulsating spirit of pleasure. You feel warmth, certainty, the ancient call with yummy, yummy rippling through your sex, belly, heart, and brain. Your yoni flows out and in like a veiled dancer, giving, then giving a bit more. You're on the edge, you're rosy pink alive. You breathe, you pant, you cry out, then finally, you come home. One friend pretty much summed it all up, saying, writing about orgasm is like dancing about mathematics. So somewhere in the midst of that is the answer to your question. All right, let's see. Is it possible to not have the ability to orgasm? That's a great question. The short answer is it's possible, but exceedingly rare. There are some neurological conditions, for example, where the actual physiology is interrupted. Although even lots of women that are paralyzed from the waist down, for example, many of these women can still have orgasms in a different sort of way because the neurology of the physiology of orgasm is so complex. And the body is amazing. If one pathway doesn't work, the body wants to experience pleasure so much that it can often find another pathway. So it's very rare for women to physiologically, anatomically, neurologically be incapable of orgasming. Like I said, the majority of the time if somebody's having a hard time having an orgasm, it's here. We as women, it's complex. Women's sexuality is so complex. Men are way easier. No offense, guys. Women are just much more complex. For example, take Viagra. If a man can't get it up, you send blood flow to the penis, and boing, he's ready to go. And then he gets turned on, and he's ready to have sex. This is not the same for women. You give women Viagra, and you can bring blood flow to the clitoris, and you can bring blood flow to the vagina, but it doesn't affect their libido. It doesn't make them want to have sex. So they've studied Viagra in women, and it doesn't work. And it's not that it doesn't function the same way it does in men. It does function by bringing blood flow to that area. It's just that, bringing blood flow doesn't affect how a woman feels about her sexuality. It doesn't make her feel turned on. Guys are sort of programmed. They wake up in the morning with an erection, and they're like, oh, is there a woman around? They grow up associating that if their penis is ready to go, then they're ready to go too, by golly. And women, it doesn't work that way. We are so complex, and our sexuality is so it's so caught up in the way our mind works that you can bring blood flow to the clitoris, but if we're pissed off at our boyfriend, forget it. You're not getting any. I don't care what's going on down there. And even if you're stimulated, even if you're being touched, if there's something in your mind that is disconnecting you, let's say you were molested as a child, or you were raped in the past, or you have some issue. You were raised in Catholic school, and they told you that you're, a whore if you get excited by something that a man is doing to you, or, all of these things that we get in our brains based on how we grow up and how society treats us. They keep us from being able to fully explore our own sexual pleasure. They keep us from being able to really connect into our bodies. And so the more we can do to kind of erase all the negativity that many of us carry in our vaginas. And like I said, I think the more we talk about these things, the more we go through these kinds of questions and we make it part of our dialogue, the more we open it up so that we can access that orgasmic potential within us, because almost all of us have it. It's very, very rare that I've worked in depth with women, because I do a lot of this. A lot of my clients at the Owning Pink Center, where I practice in Mill Valley, California, are people who have had sexual dysfunction issues, and they come to me wanting to reclaim their orgasmic potential, and almost everybody can. But it's not an easy journey. And it takes a lot of trust and faith and finding a practitioner that you feel safe with, and being in a relationship that's good, and all of that. So again, just like I said before, the biggest piece of advice I would give you is learn how to self-pleasure and see if you can have an orgasm by yourself. Because if you can have an orgasm with somebody else. All right. Is it possible to lose feeling in your clitoris? I didn't answer this one already, did I? Okay, I read it, and so I wanted to make sure. Well, yes, it is possible to lose some feeling in your clitoris, and women, as they get older, often state that they are feeling less sensitive in their clitoris than they did when they were younger. And this is particularly common among women who have experienced menopause. So I hear that a lot. I've been through menopause. My clitoris has decreased in size, and that's common after menopause because, again, the effect of estrogen is less on the clitoris, and so there's less blood flow, and the decreased blood flow can actually make the clitoris feel less sensitive. That said, because that sounds depressing, and we certainly get a lot of messages that getting older is not a good thing, that this is sort of a youth-centric culture. That said, I can tell you right now, some of my dearest friends are in their 60s right now, and they're postmenopausal, and they are having the sexual time of their lives. And I hear this more and more because I think something else shifts during that menopausal process, where, we've sort of done the whole being a mommy, living up to what society expects of us as parents, and we kind of go through this sort of new liberation. And I see this a lot in some of my menopausal patients, where they've done that. Okay, they've taken care of the husband, they've taken care of the 3 kids, they maybe put their career on the back burner, and like, now this is my time. And in that transition, that process of kind of rebirth that comes with menopause for many women is often sort of a sexual liberation. I hate to say it, but some of these women are also in this kind of liberation phase. Their marriages are ending. Their husband just ran off with the secretary because he's having his midlife crisis. They may be out there sort of exploring a new way to define themselves and a new way to relate with themselves as a woman. And so, certainly it does not have to be a negative thing. But if you believe that getting older is going to make you less sexual, then again, mind-body connection, then that will be a self-manifesting thing. But if you believe that you will continue to be able to embody a pleasurable life and to be a sexual being throughout your life, you can. And even if you feel like you're losing sensitivity in the clitoris, you can rewrite that story. Another question that might come out of that is it possible to lose feeling in your clitoris? The other question I often get asked is, can I lose feeling if I use sex toys? Can I lose feeling if I masturbate? And in general, the answer is no. The body is made such that it's sort of, use it or lose it. The more you use it, the more the body learns how to put those neurological pathways together. So when you teach the body how to experience pleasure, you actually teach it, neurologically speaking. They've looked at this. It's fascinating to me. You teach it physiologically how to continue to experience that sort of pleasure. So whether you're using sex toys, you're masturbating, you're having sex a lot, or you're getting older, don't worry. The clitoris is made to last a lifetime. In fact, I have to tell you a story about my first patient. It's in the book. Mrs. Kaufman. So my first patient, when I was finally on my own and going about the whole process of, now I've got my degree and it's time to get out there in the world. My first patient was like 80-something years old, and she was there because, honey, I got me an itch. So I'm, straight out of school and asking a million questions. I think I spent 45 minutes interviewing this poor woman. And by the end of the interview, and I had asked all my questions and taken all my notes, it was time to do the exam. And I step out, and she gets undressed, and I come, and she's about to get in the stirrups, and she says, honey, I got to tell you something first. I said, okay. And she said, this itch, I think it's from my new boyfriend's beard. And I was like, you go, girl. And it just, somehow, I had forgotten that an 84-year-old might still be, getting off from her new boyfriend's beard. But, it just was a reminder that there's no reason for any of us not to experience the fullness of our femininity and our pleasure throughout lifetime. Why do I always have to go number 2 after I exercise? That's an interesting question. I haven't been asked that one before. Do any of you guys experience that? Is that a common thing to experience? I would say that when you exercise, you are moving things. You're moving blood flow, you're moving lymph tissue, you're moving your muscles, you're definitely focusing on getting blood to the muscle areas of the body. And one of the muscle areas of the body is the smooth muscle that is around the colon. So certainly, many of you have probably noticed when you eat, you put something in this way, it makes you want to move something out that way. Well, that's because the muscles in the bowel are contracting. So when you're bringing blood flow to your muscles, then, I'm not sure I've ever read a scientific study about this, but physiologically speaking, I would imagine that, moving blood flow to the muscles in the GI system would also kind of get things a-moving. So one of the things that we tell people who are constipated is move. Why? Because movement helps move things. So that would be my answer. I think I got them. Did anybody else have questions? Thank you, dear. Yep. Will birth control negatively affect my body? Well, it depends on which body parts you're asking about. You know, we use birth control pills as gynecologists frequently because, you know, many call it sort of the Band-Aid of the uterus. So if you have PMS or menstrual migraines or really heavy periods or painful periods or endometriosis, these are all conditions that gynecologists often use birth control pills to treat these conditions. So if you're talking about will it negatively affect your body, well, in that way, it can very positively affect the body. There are some other health benefits. For example, women who have a strong family history of ovarian cancer, taking birth control pills reduces the risk of ovarian cancer significantly, like by half. So, you know, the risk of ovarian cancer goes down. So there are some positive benefits. Women who take birth control pills are less likely to be anemic, because most people who are on the pill bleed very lightly during their periods, or if you take it the way I did and skip that placebo week, you know, they may not have periods at all. So there definitely can be some positive effects. There also are some risks. So birth control pills, these are synthetic hormones, and synthetic hormones for some women can give them some side effects. So some people get really sort of moody. They just don't feel like themselves. They feel like their affect, you know, their mood is sort of blunted, like they don't get the high highs and the low lows anymore. It does put you at increased risk of blood clots. So the risk of that is exceedingly low. Again, you know, it's a very low risk, but it does almost double the risk of getting blood clots. The most common ones are called deep venous thrombosis in the legs, but very rarely those can break off and you can get a blood clot in the lung, or very rarely a stroke. So there are some risks like that. If a woman already has a breast cancer cell, theoretically, because it has estrogen in it, and breast cancer is an estrogen-sensitive tumor, then it can make the breast cancer grow more quickly. Whether or not it causes breast cancer, we believe that it doesn't, and there's some controversy over that. Most people believe that it doesn't take a normal cell and make it into breast cancer, but that if there already is a breast cancer there, it can make it grow. This is a very controversial subject. So, and there have been many studies done on it. In general, birth control pills are very safe, and women take them all the time. I think this year is the 50th anniversary of the pill. So, you know, people in my mother's generation, they remember when we didn't have the option of the pill. Now we're still trying to figure out, you know, what's the best way for a woman to have control over her body and her fertility and still have it be as safe as possible for her body. So there are lots of other options out there, but the birth control pill is definitely still the most common. What I often do in my practice, because I work in an integrative medicine practice, and many of my patients are really averse to taking synthetic hormones, I use bioidentical hormones frequently to treat those kinds of medical conditions that we talked about, like PMS and endometriosis and migraines and painful periods and things like that. I often will use bioidentical hormones, which they don't sell them at the pharmacy. You have to sort of get them compounded in a special way. And, but they work similarly to birth control pills without some of the side effects of the synthetic hormones. The downside is none of the bioidentical hormones have been tested as birth control. So you can't really use them as a birth control pill. They're sort of used more as a treatment. So it just occurred to me from answering that question. I know at the last place I went, people had some questions about what I had said about skipping periods. Is anybody curious about the whole skipping your period thing?
Yes. How do I do that?
my roadie is interested in the answer to this question.
I could have used this information last week. But
A lot of people don't know that if you're taking a birth control pill, that there are ways to kind of manipulate your cycle. And those that do know that think, well, wait, is that safe or is that not safe? So I'll just address that, because I know I didn't know that you could do this when I was the age of many of you here. And when I discovered it, I felt kind of robbed. Like, what? I'm 27 and nobody ever told me that I could have done this 10 years ago when I started the pill. But yes, you can if you're taking a monophasic pill, which means that it's the same dose every day. So if you're on orthotricycline, it's not a good pill for that, because every week the hormones are different. If you look at your pill pack, it should be able to tell, or ask your gynecologist. But if you're taking a monophasic pill like Yasmin or orthocycline or Mercet or Yaz or some of those kinds of pills, Those are all monophasic pills where every day it's the same dose. And basically the way the body's physiology works is normally what happens in a menstrual cycle when you're not taking the pill is that your estrogen and progesterone levels are really low, and your estrogen level starts to peak around ovulation. The progesterone stays really low until ovulation, and then it goes up at the same time. And then the two kind of gradually start going back down. Well, progesterone is what the body needs to sustain a pregnancy. So if the progesterone level goes up and it stays up, then the body thinks, oh, we're pregnant. And the placenta starts making progesterone, and the progesterone levels keep going up. And that's normal in a pregnancy. When that progesterone level goes down, which when you're taking the birth control pill and you stop taking the birth control pill during the week of the sugar pills, the body says, oh, we're not pregnant. It's time to have a period. But if you continue taking the pill instead of going to the placebo week, the body says, oh, we're pregnant. We don't need to have a period. And what ends up happening is it's not like the lining of the uterus is building up and building up and building up. It's just that the lining starts shrinking and shrinking. And so if you look at somebody who's been taking birth control pills continuously for a year without stopping to have a period, if you look at their uterine lining on ultrasound, it's very thin. It looks like the lining of a woman in menopause because there just isn't a lining. So it's not like it's building up and it's not shedding. It's that because of the progesterone is actually what is involved in making that lining get thinner. And so in the beginning, what we usually do with people is have them sort of take the pill regularly and then start skipping it for like 3 months at a time. And have any of you guys heard of Seasonal? It's one of the birth control pills out there. It's actually marketed there. Anybody else? Oh, we have more?
Yeah, I have more questions.
Okay.
This is a great one about razor burn. I don't know if you want to read your bikini wax story.
What's the best way to avoid razor burn? Well, I don't know if the bikini wax story is the best answer to that. You want to hear that? All right, I'm going to read you a story real quick, and then I'll answer that question. I have to find it. Bear with me for a second. I don't know my own book that well yet. Okay, so what's the best way to avoid razor burn? Well, one of the answers you would guess would be waxing. But I'm going to read to you about my own personal bikini wax story. The question in the book was, is it okay to wax your bikini line at home? And my answer was, since I've never seen scientific studies about waxing your bikini line at home and nobody ever mentioned it to me in medical school, I can only comment from my personal experience, so take it with a grain of salt. Most of my life, waxing held no appeal for me. Going to the gynecologist once a year was mortifying enough. Yes, even gynecologists get uncomfortable in the stirrups. So bearing it all for the waxing gurus to strip away layers of skin cells, stripes of hair, and my remaining modesty for the sake of pubic beauty just wasn't my bag. But one hot summer day, I decided to try it by myself at home. After all, I'm a gynecologist, I reasoned. How hard could it be? With no one around and bikini season upon me, I pulled out the home waxing kit a friend had given me as a gag gift and plugged in the wax. One simple step and I'd be bikini ready, lickety-split. Or so I thought. Hours later, I found myself sitting on one of the blow-up donuts we send home with women after they give birth, slathered in aloe vera and numbing myself with an ice pack. Needless to say, I learned a few things. Lesson number 1, do not apply hot wax without testing the temperature first. Hot wax burns the bejesus out of you, and that butt-ugly burn sticks around. Lesson number 2, let the wax cool completely before pulling it off. Otherwise, the wax will not come off in one fell, paper-ripping swoop. Instead, it leaves a gummy hornet's nest of sticky, hairy, tangled goo that scissors can't cut and additional strips won't remove. Lesson number 3, go out and buy a nice, skinny wooden applicator rather than using the humongous 2x4s they include in the kit. It is impossible to craft a porn star landing strip using a canoe oar. Without the help of a nice, delicate wooden applicator, you'll wind up with a cue ball for a coochie. Lesson number 4, don't use the fancy schmancy scissors you use to cut your bangs to chop out clumps of wax-laden pubic hair. They'll end up in the trash can stuck to the toilet paper you used to try to mop up the extra wax. Lesson number 5, make sure you pee before you start waxing. Nothing like acid on a wound to send you through the roof. Lesson number, it gets worse. Lesson number 6, load up on that wax removal product the kit recommends buying. Since my waxing was a spur-of-the-moment decision, I proceeded without any cleanup aids. Hours later, there I was, pubes tangled in the equivalent of chewing gum, careening bare-assed through the kitchen in search of utensils or products that might rescue me from my waxy nightmare. Lesson number 7, avoid all alcohol while waxing. Halfway through this ordeal, I sought solace from a leftover margarita, still in the martini shaker from the previous night's Mexican fiesta dinner party. All this achieved was a reduction in my inhibitions, resulting in lesson number 8. Vegetable oil does not clean up bikini wax. Sure, it works great to remove the beeswax I use for my art, but bikini wax plus vegetable oil equals bloody disaster, literally, by this point. Lesson number 9, make sure you put your head hair in a clip before embarking upon a bikini wax adventure. When the wax meant for your pubes ends up in your locks, it gets ugly. Lesson number 10, think twice about whether you really want to be a middle-aged woman with a vajayjay of an 8-year-old. I have to say, once all was said and done, I felt robbed. And even if I didn't, I'm far too scarred from my one horrifying experience to fly my airplane down that landing strip again, if you know what I mean. Is it safe to wax your bikini line at home? Maybe, when forethought and sense are employed. However, the moral of my story is this: do yourself and your coochie a favor and seek professional help. So, that's one answer to the question that I wouldn't necessarily recommend. Professional waxing can also be a way to avoid razor burn, but that doesn't necessarily mean you won't still get some irritation. I have a lot of women that get, professional waxing jobs come in, and they get, instead of razor burn, they get a lot of ingrown hairs. So it's, you can go and get the Brazilian, and you're not going to really get razor burn because you haven't used a razor. Does anybody know what causes razor burn? Why do we get razor burn? Anybody know? I found this kind of curious. That was one of the questions in my book, I think, that got cut, because we basically cut anything that we thought people would ask their gynecologist. And we decided that one wasn't too embarrassing, that people might actually ask, why do you get razor burn? But when you are shaving, the hair follicle kind of sticks up a little bit, and the hair comes out of it. And what happens when you shave, especially if you're shaving without good products, like we've all done it. You're about to suddenly go to a pool party and you forgot to shave your bikini line, and you're in the bathroom with, the soap from the hand dispenser, and you haven't taken a shower, and your skin is dry, and you're shaving, and next thing you know, you've got bright red bumps everywhere. Well, what happens is that you're actually cutting off the tops of the hair follicle itself. So it's actually damaging the follicle. And the best way to avoid that is don't shave, obviously. If you're going to shave, then soaking in a bathtub for quite a long time beforehand is helpful. Using a razor and shaving with the grain of the hair as opposed to against the grain. It's harder to get as close a shave that way, but you're much less likely to damage the hair follicle. I actually think there's a whole list. We have this on owningpink.com too somewhere. There are a whole lot of tips on that, and I'm not going to go into a lot of detail because I see you guys talking. But there are some tips about that on owningpink.com. So there are ways to do that. Tend Skin is another good product that you can get over the counter. Tend Skin, T-E-N-D, that if you put it on afterwards can help reduce the risk of that. So I'm going to wrap up here so that we can sell some books, buy some books. I'll go in the back and we'll do some signing. So if any of you guys feel like finding out what's up down there. And if you have additional questions that come up, feel free to just write them on these little slips of paper. We are answering some of these on owningpink.com. So if you forgot to ask your questions, go ahead and submit some of them to us. And thank you for having me here. It's a pleasure being here.